One of probably the most common things that I see after neck and back pain is probably shoulder pain. Now, when we look at stuff like shoulder pain, neck pain and back pain, there's a lot of similarities that will walk through the door as to why those issues are occurring in the first place. When we look at, especially when we look at something like shoulder pain, there's almost always a cervical, so neck involvement as a part of that, and almost always there is a problem with the upper back as well. Now, the reason why I just want to explain this is that it kind of goes into some of the other topics that we've looked at in other areas, such as the thoracic extension and the forward head carriage. And the reason being is that actually when we look at some of the most common dysfunctions, especially when we look at people's postures nowadays, the most common one is the forward head carriage, where the curve in the neck is almost reversed and the head starts to travel forward. And so what we have is then this excessive kyphosis, so this big curve in the upper part of the back, and then we almost have this big curve in again in the lower part of the back. So what we actually end up seeing is this over-accentuated, this over-accentuated, this over-accentuated. And what actually starts to happen, if you imagine, say for example, just your normal curves, your shoulder joint is going to sit here. Now, as this comes forward, what actually happens is the distance between the clavicle and the shoulder joint becomes shortened. And as a result, what we start to see is friction in this area here. And when we start to create that friction, what we start to see is start to see a couple of different things, because actually what's coming underneath that collarbone or the clavicle is stuff like your veins coming out of your arm. You've got your arteries going into your arm. You have a load of tendons and ligaments that are actually supporting the shoulder, but you also have the nerve roots as well. So you're going to get one of two things. We're either going to get pain directly from the tissues that are actually in the shoulders, or we could be getting referred pain from the neck, from either here, that's referring into the shoulder, or we could be catching the nerves again at the actual clavicle itself, and again that can start to create pain in the shoulder. So again, last thing, the position of the shoulder when the head starts to go forward, I can challenge you to this. If you slouch over and try to raise your hand above your head, you're only going to get so far. As soon as you come into upright position, you're going to find it goes a lot further. And again, the same reason being is as we come into this slouchy forward position, what happens is my collarbone comes down and my glenohumeral joint rolls in. Okay, so we're characterized by this roll in posture, which puts the humeral joint, the head of the humerus, underneath the clavicle, meaning it can't go up. And as a result, that's when we start to see those impingements either on those nerve roots, on those ligaments, on those tendons, and that's when we're going to start to see pain start to occur. So what I'm going to do today, I'm just going to run through a series of exercises that we can do to release the muscles in the front of the shoulder. Some ways that we can obviously improve the thoracic extension, which I went through last time, but also some ways that you can actually strengthen up certain muscles specifically for the shoulder. There's going to be some similarities from the previous videos, but actually this one's going to be, there will also be some new bits that you can try as well. So we're going to go through 4 exercises again to help you with your shoulder pain. For anybody with shoulder pain, I would also recommend looking at the anterior head carriage exercises and also the thoracic extension. Like I said in the previous part of this video, that most people that have shoulder issues tend to have that forward head, and they also tend to have limits in their upper back. And so as a result, I'm going to look at the muscles directly surrounding the shoulders, but I would suggest looking at those 2 areas too. Let's crack on. So the first exercise we're going to look at today is a release for the subscapularis. What you're basically going to do, you're going to take a broom, you're going to take it to either the corner of the room, or you can take it on to anywhere where you've got basically a wall you can jab it into. You're essentially going to take in place the position of the broom underneath the shoulder blade. So you're actually going directly through the armpit.
It's not a particularly comfortable position, but once we've got that position placed, what we're going to do is we're going to rotate through the movements. We're going to go into abduction and external rotation. I've showed it both from the side and the front, so you can actually see exactly where it's going, but you can see we're fully externally rotating. Now the subscapularis internally and externally rotates, and this internal rotation position is actually what brings the shoulder forward. So releasing this muscle allows the capsule to take the shoulder back. So the next one we're going to do is going to be really looking at the pec. As you can obviously see from the video, I've just showed you where the ball is going to go and where it's going to go on the front of the shoulder. So again, it just comes underneath, just underneath the collarbone. And again, same kind of movements. We're just going to move through the muscles. Now, I'm showing 3 repetitions of each exercise. I'd probably recommend go to 10 to 12, or work it within your tolerance. But we want to work through the position or the movement of the muscle, so it elongates and shortens. So we really release those. The next one's actually a strengthening exercise. This is actually for the external rotators, which is the opposite to that subscapularis. And we're really going to be looking at externally rotating, so bringing that shoulder joint back. So the reason we put the ball underneath the joint is so that we actually use the rotator cuff as opposed to abducting the arm. It also draws the glenohumeral joint down from the clavicle, again opening up some space. And all we're going to do is really try and squeeze that band out to the side without trying to twist our body, trying to make all of that movement at the shoulder. I'm going to show you that from the front as well. So we're going to put that ball underneath the arm. I'm going to take hold of the bands. They're going to go across the body, and you're really going to be trying to externally rotate. It's not a big movement, this one. It's not a big movement. However, what you can obviously see, that ball is keeping my arm in at the side, stopping me from abducting as much. We're just trying to externally rotate that shoulder, really try and actually get the pull back of the muscles to draw the shoulders back. And we've got one last one. Now, we showed you the muscle release for the pec, but actually doing a stretch for the pec and the biceps is also really good. The pecs and the biceps will, again, they'll really draw the shoulders forward. So by opening up the chest, taking your fingers pointing behind you and taking it slightly above shoulder level and just turning your whole body away from your hand, you should feel a big stretch down your chest and into your biceps. Again, with stretches, I'm showing you for a short period of time just for basically a demonstration purpose, but realistically any stretch should be held anywhere between 1 minute and 2 minutes to really be effective.